Perfect. Thanks, Christopher. And thanks to all of the panelists for your presentations and for the information. And thanks for those in attendance who've been putting their questions into the chat. If you've been following the question and answer window, you may have seen the questions reduce. We haven't blocked or deleted any. As we've answered them, or some of our clinical colleagues have answered them as we've gone along, they move over into another tab. So at the top of that box, you'll see open, answered, and dismissed. So you'll be able to see those there. So a couple of questions came in about, given the population and concentration of cases at the moment, will the vaccine only be available or targeted in cities and densely populated areas? What about Shetland and rural areas? And our clinical colleagues have responded to reassure us that the vaccine is available in all board areas, including the Highlands, and to contact your local service and they'll be able to advise you. There was a question about why anybody can get monkeypox, or why are these messages and these sorts of events targeting gay and bisexual men and other men who have sex with men? Thanks, Colin, for answering that's factually accurate and confirming that actually the very large majority of cases at the moment are in our community. And so we have a responsibility to try and look after each other, which is why we're targeting messages at those people most proportionately affected at the moment. And we'll come on to the questions that haven't yet been answered. So this is probably one, I think, on the back of your presentation at the beginning. I think, Colin, the advice was to isolate until all scabs have fallen off and healed. Any idea roughly how long that would take? And I guess as a follow-up question, anything people can do to speed that process up?
Yeah, I must say I was delayed on that one, hoping that Dan Clutterbuck will come in on it. But my understanding is it's 3 to 4 weeks from what we've seen from cases so far. And Dan, you may want to add something. There's 2 stages of de-isolation. There's one once all of the vesicles or the pox that is non-visible, that can be covered with clothes. If you can cover them with clothes, you can de-isolate to leave the home, and then I think there's a longer isolation period for any pox or vesicles that are unable to be covered by clothing. But I think the simple answer is 3 to 4 weeks. And Daniela or Dan, please correct me if I am under or overestimating.
Hi, yes, thanks, Colin. I was going to pick it up, but you've covered it very well. So yeah, I'd say 2 to 4 weeks. And also, of course, it does depend when people present and get tested, because sometimes they've had the lesions for a while. So not everybody who comes and gets tested then has to isolate for that full period. But certainly we've been finding between 2 and 4 weeks. If people have very a more severe case of monkeypox, it can take longer. There's no getting away from that, but that is a small proportion of cases. And as Colin said, the isolation, the initial phase where people have to isolate completely applies to lesions on the face and hands that can't be covered. And once those have healed properly and the scabs have dropped off, even if they still have lesions on their trunk or on their genitals, they can, they don't have to isolate in the home, but some people would then be restricted, for example, from contact with pregnant women or people who are immunosuppressed. And some people might be restricted in terms of work, for example, if they worked in healthcare until all the lesions, including the covered ones, were healed. I hope that's clear.
Great. Thanks very much, Daniel. So we have a question from somebody who's been shielding for COVID. So who are allowed to get the vaccine and what might they do if they're still shielding?
Would you like me to come in?
That would be great. Thanks, Daniela.
I suppose it's about a sort of balance of risk. So if somebody's shielding, then they may not be at risk of monkeypox if they're not meeting up with partners. So I think it would be a discussion, a sort of one-to-one discussion with that individual around if they're shielding and they're not at risk of monkeypox because they're not putting themselves at risk, or be it meeting up with people, then it might be that they don't need to travel for the vaccine. But if they are, then obviously there are things that the clinic can do. So for example, back during COVID, if anybody was shielding for any reason coming to services, we would see them first thing in the clinic. They would be taken straight into the clinic room, not being told not to sit in the waiting room, etc. So there are things that services can do if individuals feel that they're at risk.
Thanks, Daniela. And we've got some questions coming in, people apologising if they've missed something. That's absolutely fine. We've thrown a lot of information at you this evening, so please do ask questions. And I've been watching the participant numbers increase as we've gone through as well. So if you've joined late, we can repeat some of the information. And we'll talk at the end. Alistair will speak in a minute about how you can access some of this information and rewatch this video this evening as well. Can we stick with yourself, Daniela, on the vaccine? Somebody is asking, this is about testing. Will individuals be contacted, or should a person who believes themselves to be eligible or vulnerable contact their local sexual health service? Hearing from friends in London that supplies are low. Could we just revisit that, please?
So, and is that regarding vaccination? Sorry, you said. Yeah.
Yes. Yeah.
Yeah. So, so services have obviously a list of individuals who would fulfill the criteria as best we can from our clinical systems. So not everything that is within the eligibility criteria is easy to extract from our clinical systems, but some things like PrEP prescriptions, STIs, other things are. Services are proactively contacting individuals who are eligible. However, if you feel that you've not been contacted, or particularly if you've moved areas, or you've never used your local service because you've maybe accessed testing in other ways through your GP or private providers or third sector, then I would urge you to contact your local service so that they can assess you and add you to the list of individuals who are waiting to be vaccinated, or they may indeed offer you an appointment right there and then, depending on their vaccine supply.
Great. Thanks, Daniela. Sorry, as people are typing the answer to questions, it's moving around my screen, so apologies for the confusion there. This is the question on testing. Is testing only done through swabs of lesions, and how long are people waiting for results?
I can pick that up if you want.
Thanks, Daniel.
So most testing is swabs of lesions. There are other, we do sometimes do testing in other ways. For example, swabbing the throat, and occasionally on urine, and very rarely on blood. But in most cases, as we said, about 95% of people have a rash. So we would usually test from spots, but we can make a decision in each case. And as has been said, there's no restriction on testing. In terms of the turnaround, we're really lucky because the only lab outside London that set up monkeypox testing was in Scotland. So we are at best getting turnaround in about between 24 and 48 hours. And allowing for transport within Scotland from other labs, it might be a few days. But we're expecting results within days, and sometimes only a couple of days.
That's good news. Thanks, Daniel. We've got one more question listed at the moment. So if you have a question that you've been thinking about asking, there's plenty of time, please do so. We have a colleague from the NHS online who said he'll stay off camera unless there's a Nikki-shaped question and answer that comes in, and this Nikki might be a Nikki-shaped question and answer, although Colin might be happy to take it as well. There's a lot of gay men that are referring this back to, or being reminded of the AIDS and HIV crisis. Is there messaging that we can get to this part of the community, especially if they've been vaccinated for smallpox before, to put them a bit more at ease?
Hi, yeah, I'll take a little bit of this. Hello, I'm Nicky Coya. I'm Health Improvement Manager for Sexual Health with NHS Greater Glasgow and Clyde, and I use he, him pronouns. So I think it would be good just if in people's networks, if they're able to share information that they've got from tonight. So check the NHS Inform website, as other speakers have said, but I'm also very pleased that the Scottish Government has now provided funding to develop a very targeted social media awareness raising campaign specifically for gay and bisexual men and other men who have sex with men who are more likely to be in sexual networks where monkeypox is present. So we started working on that with various community organisations and with Public Health Scotland and Terence Higgins Trust, particularly where Dave's from, are really helping us do that because they have a really good track record of that. So we've got some very targeted information which will be going on through social media, through some of the cruising and dating apps, and yeah, so that's I guess our plans around the messaging. And I can completely, going back to the question, I can completely understand why I think for those of us who have a certain age, there's a resonance around what's happening now with the early days, particularly of HIV. But I think when situations like this arise, our communities, I think, are often the best response. They bring out the best in us as a community. And I can see that that's already starting to happen here in Scotland.
Thanks, Nikki. Colin, would you like to add anything to that, or are you satisfied with that response?
I think there's people better placed to talk who've got a lot more experience of the HIV epidemic than me. If they want to add anything, I wouldn't suppose to add anything other than what Nikki said, except to reiterate the messages that have been: this is not HIV. We're not dealing with something that is on the scale of HIV of the severity. Dan mentioned the symptoms, the resolution, and the relatively mild cases that we've been seeing. Very low hospitalisation and no deaths in the UK. So just to say that it's not something that I would say we're dealing with on the same scale. But from the response and the media response, I can see the similarities. And just to reiterate, the public health position is that we're not targeting this at one group of people for any reason other than we want to provide the support where we're seeing the cases. The aim isn't to stigmatise in any way. It's just to provide support where we think it would be most useful.
Great, thank you. And I know I'd received an email this morning from the LGBTI equality team at Scottish Government, forming a roundtable to talk specifically about communication strategy at government level as well. So there'll be various pieces of communication targeting various parts of the population in numerous ways around this. So thank you for that question. I don't have any other questions waiting in the Q&A box at the moment. There is about a 1 minute delay, so I'm just going to have an awkward silence before we hand over to Alistair to sum up and finish off in case anything else comes in. We've got one, thank you. Justifies the delay and not too awkward a silence. The childhood smallpox vaccination, Daniela touched on this very briefly. Does it offer any protection?
Yeah, we think it probably does. So for individuals who are not immunocompromised, then they would have one dose of the monkeypox vaccination as opposed to two. So it should give people some protection. We don't know exactly how much, but there is a theory that you would have some protection from that initial dose.
Okay, thanks, Daniela, and thanks for the question. Just do that awkward silence for the delay. Alistair, this is time to warm up your vocal cords.
Play nice. Just to thank everybody really for what has truly been a coordinated response. It's been really encouraging as a newbie at HIV Scotland, I guess. I'm pushing my luck saying it's a year, but it really has been a consolidated and a coordinated response. So thanks to Mark for great facilitation and Nikki Coyer for championing this webinar and the campaign that's just about to hit you imminently if we get up to speed with it. But I think the planning is certainly in place. And thank you to NHS, Public Health and third sector colleagues for what I think has definitely been a rich discussion. I hope the people that have enjoyed it online can go and enjoy the rest of the evening in the sunshine. But thank you all for engaging. I think it's been a very rich discussion for us all. Thank you and good night.